Droplet infection, and it is not very easy to contain this infection to one place. But despite taking all these measures, well done, but still we have some pandemic going on in our country, I can say whole globally. Though Hyderabad is again our city, we are seeing in the last I can say in the last 3 months there's a very regular news about the coronavirus being seen in the newspapers and in the televisions and all. So what is this like? How it is going to end? What is the measure now? What are we going to do with this? The public is having a lot of they are anxious about the coronavirus, and I have seen some of the patients. They are very hyper anxious. I can say they are calling me and asking whether we should buy or take oxygen cylinders on rent and take as a standby in our homes. Friends, stop here. I would say there is no need for you to become so much panic. I understand that the infection is spreading very fast, and we are seeing so many patients every day, and I can say we are seeing about this coronavirus in the newspapers, in the televisions, which made us very anxious. Just one point I would like to say here is salute to Telangana government, state government. They have done their best and they have taken the measures right from the beginning, but it is not very easy to contain the influenza viruses. It is a droplet borne infection, so it spreads very fast. So despite doing all measures, whatever the scenario it is there in our country, in our city, it is there. I agree with that, but what are we going to do with that? So in short, I will tell you very few important points. Don't get panic. See, this is like other influenza virus infections which we have seen in the past. I'm sure everyone has suffered from cold, cough in their past. It's like a seasonal flu, I can say, which comes and goes in a year, and most of the time, if you remember, we have not taken any particular medicines for that. It comes, and influenza is also like other viral infections. It is a self-limiting infection. It will go away by 7 days. The same thing happens with the corona. It belongs to the same influenza group, but only then why this hyper anxiousness is all about this is because it is a new virus, novel virus, and spreading very fast. So what we will do now is we will divide these cases into two types: mild, moderate, and severe. Moderate and severe, most of the times I would say it will take care in the isolation places or in the healthcare settings. So I'm going to talk more about the mild cases, which I can say 80 to 85% of the cases are mild. So please don't get panic. First I will tell you what are the mild cases definition. This is the fever, mild dry cough, and mild sore throat will be there, and the patient will having severe body aches. There will be no shortness of breath or no other complications, right? This comes into the mild cases. So what are we going to do with this? 80 to 85% of the cases are falling in this group. So be happy, don't get hyper anxious. How are we going to deal with this type of scenario? I'm going to tell you. You start tablet azithromycin 500 mg daily, one tablet for 3 days. Take the tablet zinc supplements which can boost your immune system in the body. Take vitamin D3, and you can also take vitamin C, ascorbic acid daily, morning and evening. These are all the multivitamins and zinc supplements, and vitamin D3, cholecalciferol, and ascorbic acid believed to boost your immune response. Apart from that, what are we going to do? Don't get hyper anxious. Don't run for here and there in the hospitals. Don't go for unnecessary investigations. Please wait. It is a viral infection. It will take minimum 7 to 12 days to come down. Unless you have a shortness of breath or you are having other complications, don't get panic. Sit in your home, take tablet azithromycin, take all the immune booster tablets, zinc supplement, multivitamins, and ascorbic acid, vitamin D3. Apart from that, immune boosters are your proper sleep. Take good sleep in the night, not in the daytime. We need night sleep minimum 6 to 7 hours. Keep appropriate hydration in your body. And the last but the most important thing is that don't take the stress, and take balanced diet. Take the diets, vegetables which boost your immune response, like citrus fruits and broccoli and kiwi fruits, which boost your immune response. Otherwise, please don't get panic. This is the mild case. These are all the mild cases, and 80% falls in that. Take this treatment and stay at home. In case if you develop severe breathlessness or any other complication, then you please report to the hospital, and you can consult a doctor where you fall into the moderate case, and they may do some more investigations in the form of chest X-ray, HRCT, CBP, CRP, and all these things. And based on that, they may add oxygen in your treatment apart from this, and they may add low molecular weight heparins, and they may add steroids plus or minus if you need. Apart from that is the third category, severe, which also comes in the hospital. Again, some more extra investigations will be done, and the treatment modality will be totally different for that. So for the time being now, you are going to have, like if you have only mild infections, just stick to this treatment what I told. Tablet azithromycin, zinc supplements, vitamin D3 and ascorbic acid, vitamin C. That's more than enough. Otherwise, nothing to worry. One last important point I would like to say here is, prevention is always better than cure. My friends, if you are having upper respiratory tract infection, please isolate yourself. Please sit in your own place. Wear mask. Wash your hands frequently. Follow cough etiquettes. These are the basic things we have learned in our childhood. Cover your face whenever you are coughing with a tissue paper or with a handkerchief. If you are not having this, cover it with your elbow side so that you can wash it immediately. And apart from that, take appropriate hydration, good sleep and good diet. You will be totally alright. You will be absolutely alright. Nothing to worry. Okay, hope I have conveyed my message. So don't worry, don't get hyper anxious, don't go for oxygen cylinders, getting it stocked in your homes as a standby, don't buy pulse oximeters and all those things. These are all useless. I would say it is all useless. Please stick to the basic treatment, stick to the basic guidelines what we have given you. And most of the WHO, ICMR and all these guidelines, if you go into the website, they have given very clear guidelines about all these things. Even the Ministry of Health and Family Welfare, even our state government, Telangana state government, they have given excellent guidelines. You follow this, stick. See, as a public, your responsibility is to follow, prevent the infection, prevent. You can only break the chain. Doctors cannot break the chain. Doctors can treat you if you get infected, but general public, please understand your role. You are going to play a very important role by breaking the chain. We always talk about the epidemiological triad, where we have a host, environment and a susceptible host and an environment. So if you could able to break this by properly hand washing, by isolating yourself, following social distancing, going unnecessary, avoiding gatherings, and if you are following cough etiquettes and cleaning your surfaces with appropriate disinfectants in your home, household bleaching powder is it's more than enough. It's good enough to inactivate or kill this virus. So please keep these points in your mind. Your public, you are going to play a very important role by breaking this infection. Hope I have conveyed my message in this short video. Thank you. Be safe and stay at home.